the JAMA Network.
Hello, I'm Dr. Lynn Babcock. I'm an associate professor of emergency medicine at Cincinnati Children's Hospital. In a very nicely designed prospective observational study, the researchers in Canada compiled 3,000 children who presented within 48 hours of a head trauma and generated a risk score that clinicians could use to predict persistent post-concussive symptoms at 28 days. There were over 3,000 children ages 5 to 18 years of age across 9 pediatric emergency departments in Canada. If a patient presented within 48 hours of a head trauma, they were enrolled in the study and they had standardized assessments that were done in the emergency department at that time of visit that also included measures that were done pre-injury and measures that were done at the time of injury to get an idea of where they were. And then they actually did measures following up for the month period following the injury. Out of a pool of 46 variables, they were able to find 9 variables that had a fairly good predictive value of persistent post-concussive symptoms. So the area under the curve for the 9 variable model was around 0.71. And from that, they generated a scoring system, and they ended up with a 12-point scoring system that had both high risk, low risk, and an intermediate risk group of those that were at risk of developing persistent post-concussive symptoms at 28 days. As physicians, we're probably not very good at estimating those that are going to go on to develop persistent post-concussive symptoms, so we're able to use this rule in order to be able to give the parents some more information about what the likelihood that their child is going to go on to develop persistent post-concussive symptoms. Also, we'll use this rule to help stratify our needs after the injury about whether they need a follow-up clinic, whether they need school-based accommodations, whether they'll need return to sports guidelines. I do feel like this is one piece of the puzzle for post-concussive symptoms and research moving forward. I think there's a lot more work that can be done, but I think this rule can help us stratify those that might need and benefit from interventions after the emergency department visit.